The reason you need to take probiotics for teeth and gums. Do you bleed when you're brushing or flossing your teeth? If so, then there's a definite imbalance in your immune system which needs addressing. This can be done through the implementation of probiotics, but they have to be the right kind of strains to help you with oral issues. Some of the benefits of taking probiotics are better overall connection between the digestive and oral system. Probiotic organisms are the first line of defense against pathogenic invaders. It's not just oral health that will benefit, but the whole body system. Some people have reversed allergies through the consumption of probiotics. But if you want to learn the specifics about the relationship between probiotic bacteria and a healthy mouth, then make sure to watch the full video. Otherwise, you will miss out on the important bits. First, let's talk about the oral microbiome. To date, around 280 species of bacteria have been formally identified and named. These bacteria live harmoniously together in various areas, such as your teeth, gingival sulcus, tongue, cheek, hard and soft palates, and tonsils. We tend to focus primarily on teeth and gums to keep our mouth healthy, but we should not neglect other areas of the mouth as this is where bacteria colonize. This in itself is not a bad thing at first because the majority of bacteria are good and don't cause us any problems. But once the balance is thrown out of whack, then you start to see issues emerging. When this community becomes disrupted and out of balance, whether by poor diet, lifestyle, drugs, or disease, it results in a state of microbial imbalance called dysbiosis that wreaks havoc on the normal immune system response. This leads to numerous problems in the mouth, including cavities that arise from excessive acid-producing bacteria and gum disease that contributes to tooth loss as well as inflammatory diseases throughout the body. The invaders. An example of such a bacterium is Porphyromonas gingivalis. This organism is found in oral cavities and believed to play a big part in the development of periodontal disease. But it's only through the creation of biofilms within the oral cavity which creates a massive problem. The difference between normal and oral probiotics. The main difference between the two are the types of organisms present within them. Regular probiotics tend to be native to the gut, and they tend to be administered via capsules so it can resist the powerful acids in the stomach. Survivability is very important when it comes to regular probiotics, which is why it's important to choose a high-quality product with many diverse strains and a high number of colony-forming units. Oral probiotics, on the other hand, contain strains that are naturally found in the oral microbiome and are available in chewable tablet form or powders. There are some specially formulated probiotics that can effectively work for both oral and digestive systems to give you a well-rounded boost. The best probiotic strains for teeth and gums. The most commonly used probiotics in general are Lactobacillus and Bifidobacterium, which are quite commonly seen in the normal flora. Some studies have even suggested that consuming products with these two strains has the potential to reduce the number of mutans streptococci in the saliva. Some other powerful probiotic strains that are full of goodness are S. salivarius K12. This bacteria is naturally found in the oral and mouth cavity, which makes it a good strain to use. Its main benefit is the antimicrobial activity it possesses against Streptococcus pyogenes. It's quite commonly found in yogurt and may also protect you from gum disease. It does this by releasing bacteriocin-like inhibitory substances. These proteins stop the growth of harmful bugs. S. salivarius M18. Strain M18 is used as a probiotic and produces multiple bacteriocins targeting the important karyogenic species, Streptococcus mutans, as well as enzymes dextranase and urese, which could help reduce dental plaque accumulation and acidification. It also reduces the development of pockets between the roots of teeth and gums. The only thing is, M18 probiotic S. salivarius strain in the mouth showed its persistence was dose-dependent. A consistent higher dose may be needed to gain full benefits. So essentially, these two species of salivarius may prevent oral flora imbalance and inflammatory response. They can also help your immune system protect your mouth. Any evidence probiotics help teeth and gums? We found the following trial that was conducted over at Life Extension. Researchers conducted a randomized trial that included 39 people with chronic periodontitis. The subjects were randomly assigned to receive either a placebo or L. planarium L137 supplement for 12 weeks. Over the course of 12 weeks, researchers measured the probing pocket depth, which is the distance from the gum line to the bottom of the tiny pocket between the gum and tooth root. A normal healthy gum pocket is 3 millimeters deep or less, and a depth of 4 millimeters or more defines periodontitis. Deeper pockets are a clinical measure of periodontal disease. After 12 weeks, subjects supplementing with L-Planarium L137 had a 64% greater improvement in pocket depth compared with placebo recipients. This remarkable study showed it's possible to improve periodontal disease through modulation of the oral immune system. We've placed the link to the article in the description box below if any of you nerds would like to read further. How to choose the best oral probiotic supplement. When choosing an oral probiotic, look for options with high strain count, which is measured in colony-forming units abbreviated as CFUs. Keep in mind, though, that oral probiotics will usually have a lower strain and CFU count than regular probiotics. Also, be sure to check for beneficial strains like S. salivarius K12 and S. salivarius M18. There are so many flooding the market, it's hard to know which are legit and which ones need to be avoided. Amazon stocks a wide range of probiotics, but the most popular one seems to be ProDental by Hyperbiotics. Browse around and see what works for you the best, but make sure the colony-forming units are high. That's it for today, but before you go, please make sure to subscribe, share, and comment. Thanks, and we'll see you next week.